This short presentation is to introduce the acute receiving station. This station will involve 10 minutes of interaction with a simulated patient, followed by 5 minutes of questioning with the examiners. During interaction with the simulated patient, you should gather relevant information through an integrated history and physical examination. As time is relatively short, it's up to you to decide what to ask and what to examine. At the end of the 10 minutes, you should try and summarise your findings to the patient and allow the patient to ask any questions they have or address any concerns that the patient has raised. Before the session starts, you will have a chance to read a short introductory statement to prepare you for the station. This slide illustrates the type of scenario that you will come across in the acute receiving station. You can see that there is some clinical information and an outline of the task that you have to complete. There are also some detailed candidate instructions on this sheet. Hello, Stephanie.
Yes.
Hi, I'm Alan Japp.
Hi. I'm Vicky Talentine. Hi.
Okay, so you know what you're going to be doing in this
Yes.
station. You have 10 minutes to gather some information through history and relevant clinical examination. You've had a chance to read the scenarios. Are there any questions you want to ask before you start?
I don't think so.
No? Okay. In your own time then.
Hi, I'm Stephanie Pentwick. I'm one of the fifth year medical students.
Hello,
Would it
Nathan.
be okay if I just double checked your name and date of birth?
James Miller, 181256. I'm 60.
Great. So I'm just going to have a chat with you about what's brought you in and then examine you if that's okay.
Right, yes.
So what's brought you in today, Mr. Miller?
Well, I went to my GP yesterday because I had just been sitting sort of vacantly in the chair relaxing, and I became aware of my vision being something was happening, and it gradually got worse. So I became a bit concerned. I shouted at my wife to ask her to come through and she'd have a look at my eyes because did she see anything wrong? And she said, no, there's no difference. But as I just was sitting there relaxing, I became aware it was getting more severe. My vision in one eye was getting more and more blurred.
Okay, so it was blurring of the vision that
Yes.
was.
Yes.
And which eye was it?
It was my right eye that was affected.
Okay. And did you try closing one eye to see what it was like through each eye?
I did.
Okay.
And when I closed my right eye and looking through my left eye, it was quite normal. But when I did the other eye and I closed my left eye, I couldn't see.
Okay, so it was just the right eye.
Just
it was
the right
affected.
eye that was affected, yes.
And how long did this all last for?
It lasted for about 30 minutes. And then it receded and I guess came back to what I would have thought was normal.
Okay.
And I've not been aware of it. You know, when I woke up this morning, for example, it was all right.
Okay, so now you think vision's back to the same in both eyes?
I think so, yes. Okay. So I went down to my GP and just explained that. So that he sent me up just to see yourselves.
And did you have any other symptoms at this time?
Not that I'm aware of.
So no headache at all?
I didn't have a headache, no.
No weakness anywhere?
No.
No pins and needles or tingling?
No.
No, that's fine. And you're not someone that's prone to headaches?
No.
No, so you never had migraines in the past?
No, I've not had them.
Okay. And
I'm not sure I would know actually. If
You're
I
not
did
sure?
have a migraine, I've had the odd headache, but
yeah, fair
no,
enough. Yeah,
no.
that's fine. And do you have anything else in your past medical history?
I consider myself reasonably fit. The only thing that I take medication regularly for is I have hypertension.
Right. And what do you take for that?
It's Inosopro.
Lisinopril.
That's the one, yes.
And is that the only medicine you take?
Yes.
And any allergies to any medicines that you know of?
Not that I'm aware of.
No, that's fine. And before this episode came on, was there any warning, or did it come on suddenly or gradually?
No, I just became aware that that looks a bit blurred,
Okay.
and the more I concentrated.
Okay. So it came on quite suddenly then?
Yes.
And
yes.
no warnings at all?
No warnings, and I've never experienced this before.
Okay. And any conditions running in the family at all that you're aware of?
No, I can't say I am.
No. And no histories of strokes or anything like that in the family?
No.
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 And are you a smoker at all?
I do smoke, yes.
And how many do you smoke?
I smoke about 10 cigarettes a day. Yes.
And how long has that been for?
Really all my working life, probably about 40 years.
Okay. And do you take much alcohol?
I don't consider it as much. I probably will have a couple of glasses of red wine nearly every night, if I'm honest with you.
Okay. And do you take any recreational drugs at all?
No.
And who do you stay at home with?
I stay at home with my wife.
And just the two of you at home?
Yes, my children are in their 20s and they have moved out to flats of their own.
And what do you work as?
I work in a bank.
Okay. And have you always worked in a bank?
Yes, I have.
And you mentioned you've got high blood pressure that you know of. Is your cholesterol high that you're aware of?
I wouldn't be aware of it. I'm not aware of it. I mean, I just go to my doctors for repeat prescriptions. I think I can't remember really having any tests. I wouldn't know what tests were actually.
Okay, that's fine. And if it's all right, I'm just going to have a run through of the systems just to make sure everything's in working order. A lot of the questions answer to this might be no. So you've got no troubles with the chest at all, no chest pain?
No.
No, no shortness of breath?
No.
No cough?
No.
You're not bringing anything up?
No.
No trouble with the waterworks?
No.
And no trouble with the bowels?
No.
No. Grand. And as you said before, no weakness or troubles with that at all?
No. No.
Great.
No.
So I'm just going to repeat it back to you if that's okay, and if I've missed anything out, you want to let me know anything else, just let me know.
Yes, I will do so.
So last night, for it lasted about half an hour, your right eye suddenly got blurry vision, came on quite suddenly. Your wife had a look and the eyes looked okay to look at. Lasted about 30 minutes before going away, and now it's all back to normal.
Yes.
No other symptoms at this time, no headaches or weakness or anything like that. Your only thing in your past medical history is a bit of high blood pressure, for which you take lisinopril. Otherwise, usually fit and well,
Yes.
and you do smoke about 10 cigarettes a day. And is there anything else you'd like to let me know?
I've been taking those pills for about 15 years, but whether that's significant or not,
So
I don't know.
quite some time.
Yes, yes.
And is it okay if I have a quick examine of you, if that's
Certainly, by all means.
That's great. So Mr. Miller is comfortable at rest. Let's have a quick look at the hands first, if that's okay. So at this point, I would take blood pressure.
Okay, the blood pressure is 146 on 84.
I'm just going to quickly look into your eyes, if that's okay. That's great. And if you can just look straight ahead for me, I'm just going to have a look into the pupils, so just shining a light into the eye. It's a wee bit bright. Would you like to go on to assess endoscopy?
No, don't need to do that.
And do you usually wear glasses, Mr. Miller?
I do, yes.
You just pop those on for a second.
Thank you.
And if you could just close your left eye and cover it with your left hand. And could you just read the top line here?
Please clean your hands with this gel.
That's grand. And if you could just close your other eye and cover it with your hand, that's excellent. And the same again.
Please clean your hands with this gel.
And those look the same with you for both eyes.
Yes.
Grand. And if again, could you just cover your left eye with your left hand? And when you look at me, can you see my whole face?
Yes.
Can you see both my hands?
Yes.
So I just want you to say yes when you can see my fingers moving.
Yes. 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 Yes.
That's great. And if you can cover your right eye with your right hand, and the same again, just say yes when you see my fingers moving.
Yes. 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 Yes.
That's great, thanks. And you can let your eyes relax now. Just have a listen into the neck. So just take a deep breath in, and hold it. And breathe away normally. And deep breath in, and hold it. And breathe away normally. That's fine. Thank you very much, Mr. Miller.
Okay, Stephanie, you've got 2 minutes left.
Okay. So just summarise my examination findings. Mr. Miller was comfortable at rest. Pulse was regular. Good volume, about 80 beats per minute. There was no signs of hypercholesteremia in the face or hands. no carotid bruise, audible, and visual acuity and fields were normal, so normal examination. Mr. Miller, do you yourself have any questions for me or any concerns?
I suppose the main one is that was I having a stroke of some kind or other?
Okay. Well, it does sound like what you might have been having might have been to do with reduced blood flow to the eye, quite similar to what people call a mini stroke, and it's treated very much the same way. The other thing that I was thinking it could be was something like a migraine, but I think my main worry and probably the main thing I think it would be the reduced set of blood flow to the eye. In terms of where we go from here, first, so it's getting the blood pressure managed. So it's still a bit high just now, so probably need to either increase the medicines or start a new medicine to control that.
Right.
Probably will start a medicine to control the cholesterol and test your blood for the cholesterol levels. So that would be a statin. I'm not sure if you've heard of statins.
I've heard of it.
Yeah, they're just a medicine that lowers the cholesterol,
Yes,
so
I
probably start that and refer you to a clinic called the TIA clinic to do further investigations and assessments, and they'll probably want a scan of the neck, what we call a Doppler scan, just to make sure there's no clots there or anything that would predispose you to having a stroke in the future.
Right.
Okay, and what could help from yourself is stopping smoking, as I'm sure you've heard before. That can increase the risk, and we would recommend you try and cut down smoking. And you can speak to your GP yourselves about nicotine replacement to help with that if you'd like.
Right. So it could recur, do you think?
It is a possibility, yes. So.
Thank you very much, Doctor.
So Stephanie, what are your main differential diagnoses?
So I would say my primary differential would be one of amaurosis fugax from the history. The second differential I was considering would be one of a migraine aura, but I think currently I think amaurosis fugax is the most likely to be explored.
And so what's your management plan for this patient?
So the mainstay would probably want a secondary prevention. I'd want to ensure his blood pressure is a bit better controlled. Probably start him on a statin and refer to the TIA clinic, and investigation with scanning of probably carotid Dopplers.
Thank you very much.
Here is an example of an acute receiving station mark sheet. Examiners may make notes on this sheet as they're going along through the scenario, but will complete most of it when you've left the room. You'll be assessed against the performance domains that you see on the mark sheet, but the main mark that's taken from here is an overall assessment based on your performance in the individual domains.